Right, so thank you for those tallies. There has been yet another alarming rebound, as I mentioned, in our daily infections here in the country. And Shin YE-EUN joins me now with more domestic coverage. YE-EUN, welcome back.
Great to be here, Sunny.
Right then, let's begin with more details on Korea's grim milestone.
Sure, Sunny. So Korea has seen its total COVID-19 case count surpass the 10 million mark in just 792 days. The exact figure stands at 10,427,247. And we've seen caseloads go up very quickly due to the spread of Omicron and its subvariant BA2, also known as Stealth Omicron. To give you a clearer picture on how quickly we got from the 1 million mark to 10 million, caseloads have jumped tenfold in just 44 days. It's only March, but the number of cases reported so far in 2022 take up around 93% of the accumulated total. And if you recall, when we passed the 1 million mark back in early February, the KDCA said Korea had the lowest transmission rate compared to other OECD member states, similar in size in terms of population. It took Korea 748 days to reach 1 million cases, while in Colombia, only 233 days. For Spain, it took 264 days, and for Australia, known for its strict lockdowns and travel restrictions, it took 715 days. So if we compare transmission rates before and after the surge of Omicron, we can see just how contagious the variant is.
Right. So under the latest tally, YE-EUN, 1 out of 5 people in Korea has had COVID-19. But I hear many tested positive after a few weeks following their primary infection. Are we looking at rampant cases of reinfection?
I think this is an important question for many of our viewers, and the short answer is no. Testing positive for COVID-19 again within 45 days of originally contracting the virus is not classified as a reinfection case. In a briefing on Tuesday, health authorities said in order for one to be considered reinfected, 90 days must have passed. Citing domestic and overseas data, authorities said positive tests within the first 45 days may be a result of viral residue being picked up through testing, and that reinfection risks are very low during this time period. It's only those who report symptoms or those who have traveled abroad and come back with a positive PCR test result after 45 days who can be considered to be reinfected.
I see. Moving forward then, YE-EUN, when might we see then an end to this relentless surge of Omicron infections in the country?
Right. As to when South Korea will see a drop in the number of infections, Prime Minister Kim Boo-kyum said this will happen in the next few weeks.
The next 2 weeks will be the turning point in overcoming the pandemic. If we endure this a bit more and abide by all measures, we will see caseloads come down quicker and reduce the number of deaths.
The Prime Minister added that authorities will make sure to have enough ICU beds and specialized hospitals for COVID-19 patients in case there's a surge in the number of critically ill patients and deaths amid the Omicron peak. Authorities are also set to expand administrative and financial support on the medical front. This includes addressing the shortage in cold medicine at pharmacies nationwide due to its surge in demand from COVID-19 patients or those showing suspected symptoms.
All right, YE-EUN, thank you. But do stay behind for more talks then.